around personal services. This is a town hall meeting that we're working on in collaboration with Buncombe County. Today you're going to hear from the health department about the phase 2 information. You're going to have the opportunity to ask lots of questions. We would ask you to please use the chat feature rather than using the Q&A. That will allow us to all see your questions and respond to them in a timely manner. This morning we have Fletch Tobin, the Public Health Emergency Preparedness Director for Buncombe County, who's going to give us an update. And he is joined by Jessica Silver, who is the Environmental Health Administrator with Buncombe County. So we welcome you, and we're excited about the prospect of reopening. Personally, I can't wait. I've already got my appointment scheduled. So we thank you for being here. Fletch?
Yeah, good morning, everyone. Good to be back with you guys to discuss, our progression through these phases. Also, glad to have Jessica Silver on board as our Environmental Health Director for the county. Go ahead to the next slide. I don't know if prompted, but so state and Buncombe County will be going to phase 2 at 5 p.m. today. I just want to talk in general about what that entails, and then we'll get down to some specifics for these close contact services for you guys. So the stay-at-home order, which we've been operating under for the last month, 6 weeks, is now lifted, and it's changed from a stay-at-home order to a safer at-home recommendation. So still asking people if they don't have need or specific reasons or things to be at home or out of the public as much as possible. One of the biggest changes is a change in our mass gathering restrictions. So previously that's been 10 people indoors or outdoors. That's changed now, so it's still 10 people indoors and 25 people outdoors. And these restrictions don't apply to the businesses. This is just general mass gatherings. You guys will operate under a different guidance for inside your business, and I'll get to that later. So restaurants are allowed to open at 50% capacity with specific requirements and constraints. Salons and personal care, you guys are allowed to operate at 50% capacity with several constraints we'll get into. Pools, some things staying closed, bars, nightclubs, museums, playgrounds, gyms, indoor entertainment venues. We're still really emphasizing the 3 W's. Wear a cloth face covering, wait 6 feet apart to avoid close contact, and wash your hands. And locally, we're talking about 2 more W's. Wipe down high contact surfaces with increased frequency, and wave from a safe 6 feet distance. Try to avoid handshaking, hugging, close, intimate kind of contact. We're moving to phase 2, but COVID-19 is here to stay for the rest of the year. There's still a legitimate threat. There's still a concern that we could eventually overwhelm our healthcare systems. So we have to remain vigilant and steadfast in our precautions, although we can mitigate going forward and start reopening our economy. So I just want to reemphasize, we're going to have, as a nation, we're going to break 100,000 deaths this month from COVID. So it's still a real threat. So asking everybody to take these precautions, these constraints and requirements for your businesses very seriously. The commissioners did vote last night to make wearing a mask mandatory. I think that's going to only apply to unincorporated Buncombe County and Asheville City, but that was passed 4-3 last night. So there will be signage and steps taken to make that clear to everyone. It's not going to happen today at 5. It'll probably be delayed till next week so people have time to prepare. But masks were made mandatory. Enforcement of that is it's not going to be criminalized. Is the terms they use at the commissioners meeting. It is going to be a mandate, but would not be criminalized. And we're still looking for some more guidance from there. Our campaign is shifting from stay safe, stay local to stay safe, stay smart. So you see that branding going forward. Go to the next slide. So talking about personal services and getting down to some details for you guys now. And this is taken So the governor's order, Executive Order 141, it'll be on our website later today. It might be there now, but you can find it on Governor Cooper's executive orders. And then there's also the FAQ document accompanying it. So those come together as we adopt them. They're both legal documents for this phase 2. So what you see on the screen right now is pulled from the FAQ document for personal care, grooming businesses, and close contact services. So we're going to walk through those real quick. What I asked for you guys, when we talked about this is still a serious threat, we really need you guys to make an honest assessment with yourselves. Can you meet these criteria? And if you can't, we can help you, connect you to resources or help advise you how you can meet them. But if you can't, you really need to consider, for the public safety and public health, modifying your business or not opening. So you have to please take these very seriously. So new emergency maximum occupancy. This is similar to what we've seen previously with grocery stores and retail. 50% of stated fire capacity or 12 customers per 1,000 square feet. And that's with the kind of caveat that they have to be able to maintain 6 feet apart. So all that stuff comes together to give you what it should look like inside your business, which probably means you might have a higher capacity, but you can't necessarily have all those people in a lobby waiting. You're going to have to ask people. Maybe you could have 1 or 2 in the lobby, and everyone else has to wait in their car until you have space to let the next customer come in. So it's a holistic thing. You don't just look at just the 50%, and maintaining 6-foot distance to the best extent possible. Arrange seating groups, lobbies, service stations, whatever your business is, to allow for 6 feet. Workers and customers should be wearing face coverings, and that this changes a little bit for Buncombe County because we're mandating it regardless of 6 feet. I think the language is going to say within a indoor space accessible to the public or something along those lines, but it's going to entail all retail, all commercial business in actual city and unincorporated Buncombe County. You're going to see a phrase a lot. It's the core signage, screening, and sanitation requirements. That's laced throughout the new orders. And basically what that means is you have to have on your storefront posted your new emergency maximum occupancy. So whatever that 50% is, or 12 per 1,000 square feet. And that 1,000 square feet includes backup house. So it's not just service area, it's the entirety of the facility. You have to post signage to remind customers and staff what's expected of them during phase 2. And we have those resources on our website. I think the chamber has some resources on theirs. So you just have to have some signage telling them what's expected of them, best practices, have to wear face covering, have to keep 6 feet apart, reminder to wash hands. You have to conduct daily screenings of your employees for symptoms. So not necessarily having to take the temperature, but you have to be asking them to affirm that they don't have any fever, cough, or any of the myriad symptoms. And we have resources for that as well on our website. If somebody's sick, you need to immediately isolate them and send them home. And you need to make sure you're following EPA and CDC guidance for cleaning. So that's kind of what, when you see signage, screening, and sanitation, that's all kind of encapsulated in that phrase. You see cleaning. So really a lot of this is making sure it's not just end-of-day cleaning now, it's between customers. You guys are wiping down, cleaning, sanitizing, washing hands with increased frequency. At points of sale, so like a checkout counter or like waiting rooms, even outside the store, if you're asking people to wait outside so you have space, we need to have 6-foot intervals marked so people can maintain that distance. And it's not just 6 feet linear. You don't want 2 lines at 6 feet intervals, like 2 feet apart from each other. We want to make sure it's a 6-foot radius. And like I said, daily symptom screening of workers. Go ahead and go to the next slide. So like I said, that's really just covering what was in the FAQ, which reflects in a little bit easier language what's in the order itself. I'd really recommend everyone here download both the executive order, the FAQ document, and then once it's available and signed this afternoon, we'll push this out as well, but the local Buncombe County declaration, which is going to kind of reference these and have a couple of different stipulations. Nothing different for this industry, but there will be some, like we're mandating masks. We're doing some different things with the restaurants. So just be aware that there are some stipulations. There's not 100% across the board the same as the governor's order. Yeah, and so that's kind of where we stand as far as our order coming out. I guess I'll turn it back over to you, Kit.
Okay, great. Folks, feel free to type in your questions into the chat. So Fletch, we've already had a question from a solo practitioner. I mean, I know that a lot of folks will end up purchasing a space within a studio, for example, if they do hair. So those people, how would you suggest they approach dealing with, so in terms of posting the rules? Do they have to post them in their own little cube, or does the overall salon need to be responsible?
Yeah, that's a great question. So if you're one of these places that maybe has like partitions between studios, or even studios, but it's in like a bigger kind of like warehouse environment, I don't know how you guys describe it, but I'm familiar with what you're discussing. We're probably going to take that. Need to take that capacity issue holistically. Like, it's not the individual cubicle or individual salon; it's the building. So that signage can be posted at the entrances and exits to the encompassing facility. It doesn't have to be the individual booths. What should be probably posted at the individual booths are the hygiene and sanitation expectations. So the requirements, the signage on front, but you guys should just, because what we've seen from these town halls, from your guys' input, just because we're open doesn't necessarily mean people are going to be, probably a lot of people actually be running to your services right off the bat, but a lot of people aren't necessarily going to feel safe. So part of what that signage is it holds you accountable for the measures, enacted by us in the state, but also informs your customers to know what you're doing to ensure their safety. So it's communications in both directions. So the signage that we're putting out, that the chamber's putting out, the applicable parts need to be at the entrance to the facilities, and then the individual booths, I'd recommend having some of the signage and recommendations just to point to facilitate discussions with customers and clients.
And I've put a couple of things on the chat in terms of they're pieces of an overall virtual toolkit. One of them is a link to a list of PPE resources. We've tried to collect, we contacted all our strategic partners to get as much information as we could about people who provide masks and hand sanitizer and gowns and things of that nature. So they're on that list, and should you know of another source and want to share it with us, we'd love to do that. But then there's also a link to the county's compilation of printable materials that you can use, which includes, it can be an employee log that is there, the self-checker is there to determine, you use those things to determine whether or not your employees are sick, if that's the case for you. One of the questions you've got is are people required to take temperatures?
Yeah, so that's a good question. So if you have the touchless thermometers and they have the staff or resources to do that, that can be part of your required daily screening of employees. But temperatures in themselves are not sufficient, because we know 50, possibly up to 75% of people who have COVID-19 will never display a fever, but may have other symptoms. So when we say the daily screening, the most important parts of that are the questioning of symptoms. So that's the resource we share. You can couple that with temperatures, but temperatures alone are not a good indicator, and actually might give a false sense of security, because someone might have one or two other symptoms and you take their temperature and maybe it's only a 99, and they might get a false sense of security that they're not sick. But really, we're finding that fever is not even one of the leading indicators of COVID-19. It's just part of the puzzle to put together. So no, temperatures aren't required. If you could couple them with your daily screening questionnaire, you can do that, but it needs to be more than just temperatures.
All right, what about with clients, Fletch? So if I'm going to get a haircut and they're not required to take my temperature,
No, no,
Or
no requirement for that.
or any other
If,
type of screening?
what was that?
Or any other type of screening?
No. So part of the signage is it's informing clients that if they have any symptoms that they need to go home and isolate or quarantine themselves. And you guys can also question them on that as they come in, but we're not requiring you to do the screening or temperatures of clients.
Okay,
You're
great.
welcome to implement that on your own. And the public health will support that, but that's not a requirement.
Here's a question from Diane. Has the CDC changed their thoughts on the virus being transmitted from surfaces?
I haven't seen any change from the CDC in that regards for several weeks. I think we still know, depending on the type of surface and the environment, it can be extended, through days for different surfaces. I also know a lot of the studies we see when we talk about cardboard or plastic are in kind of like pristine lab settings. So when you talk about stuff that's in real world, exposed to sunlight, exposed to breezes, exposed to different factors, it does degrade faster. But there are concerns that it can linger for days on different types of surfaces.
Okay.
Yeah.
Lisa has asked, will there be an in-person hotline for Buncombe County businesses to use when we have questions concerning health and welfare or interpretation of the specific rules?
Yes. So there's the business@buncombecounty.org email. And there's also our Ready Team hotline, which sorry, I don't know the number off my head. Maybe somebody can post it into the chat. But the Ready Team hotline is still active. If you have specific questions, you can email them, email business@buncombecounty.org or call. A lot of this stuff, is very new. We've only had this guidance for, a day and a half. So calling, they might have to get back to you because we're still processing a lot of it. We're still getting new questions we haven't really been able to digest yet. So email sometimes is better because it gives us time to sit, have discussion, talk through things.
Okay.
I see a question about turning away clients for not wearing a mask. Absolutely. First of all, as a business owner, you have that right to enforce, like same as a no shirt, no shoes policy. You guys can enforce the mask policy. You can turn clients away. If they don't comply, they and you ask them to leave, they start getting into trespassing charges. If anybody does become aggressive, they can quickly jump from trespassing to some sort of aggravation or disruption charge. So I recommend, if you guys are turning somebody away and they start becoming aggressive, call law enforcement. Also on top of that, now with the county mandate, and we're putting together some signage for this as well, so you guys can post county mandate in the city and unincorporated Buncombe County. And I'm not sure what municipalities will have it yet, if any, but it's mandated by the county as well. So it's not just you, it's the county mandating you. So you could do that. We've seen, unfortunately, from other jurisdictions that have done something similar, that sometimes, clients are becoming aggressive, making threats, stuff like that. I just recommend, don't handle that on your own. If people start crossing lines, just call law enforcement.
All right, next question. Is there a guidance for best practices when it comes to cleaning and sanitation?
Yes. So we'll push this out as well as a resource. So there's a couple of different things. The cleaning and sanitation guidance we've always pushed out is the CDC guidance. It tells you how to specifically clean for COVID-19. And then there's associated EPA, Environmental Protection Agency guidance, which has a list of approved disinfectants specifically for coronavirus and COVID-19. And maybe, I don't know if Ellis is on, she's usually chiming in now with those links, but we'll make sure we get those links out. But yeah, it's very specific guidance. It's actually, just for general knowledge, it's pretty fundamental and simple, the cleaning. It's, spraying down, letting stuff sit, wiping down. We've seen some people contract out for pretty expensive and extensive cleaning, like fogging and stuff like that. You're welcome to do that, but if you just meet the requirements in the CDC guidance, you're good to go for the sanitation. And if you have questions about interpreting that or best practices for that, environmental health can be a resource and kind of walk you through what that should look like.
One thing that I would recommend for you, once you get those resources on how to clean and how to disinfect surfaces, Make sure that you check your chemical to ensure that it is on the EPA list of registered chemicals that can disinfect against COVID, SARS. That's the way it'll that's the way it'll look on the label. But also, more importantly, in addition to checking the chemical, making sure that it's on that list, pay attention to the contact time, because contact times vary between each disinfectant. And in order for the disinfectant to be effective, you want to make sure that it stays on the surface for whatever the manufacturer's label says. And that can range from 2 minutes, 5 minutes to 10 minutes. And that's a long wait time. So please use that resource once we send it to you.
Thanks,
I
Jess.
also point out real quick, because of all this stuff, as we open for phase 2, for you guys and your staff, there's going to be a lot of different standard operating procedures as far as sanitation, hygiene, cleaning, how you interact with customers. I really recommend you guys to develop some kind of checklist, standardize how you're doing, because it's new stuff. We don't want to be missing steps. So have just new checklists, and you can have checklists for your staff, for like after a client, how you turn over the station. Maybe even you can also have checklists for clients coming in, what's expected of them. This is new for everyone. Just kind of makes sure things standardized and makes it easier for everyone if they're just going down a list.
To the audience, I want to remind you to please put your questions in chat rather than in question and answer, because when it's in chat, it can be seen by the panelists more easily. That being said, I'm going to answer some of the ones that were inadvertently put on the question and answer page. We have Donna indicates she's concerned about the use of personal protective masks. When a client comes in wearing one, they have been wearing in public. I feel a disposable one is necessary. What are your thoughts about that, Fletch?
Yeah, so that's a valid concern. We know in general there are concerns with people wearing masks or face coverings all day. But I think really, as long as they're smart with how they're handling that mask, that risk is very minimal compared to the risk, the respiratory droplet exhalation risk from not using one. So yeah, there is some associated risk. You want to make sure people aren't taking their mask off and like running it down your countertops or putting it on other surfaces. So mask needs to stay on the face. If they're not on the face, try to have them keep it on themselves. If you do have resources for disposable ones and you want to ask people as they come in to do that's a great practice. We know it's not always easy to get, these large quantities, bulk shipments of these masks still. So not a requirement, but if you have that resource, I'd encourage you to do that if you want.
Another question, if a massage therapist does not feel safe returning to work because they are closer than 6 feet from clients, can they receive PUA assistance?
So those financial questions are a little bit out of my wheelhouse. I don't know if anyone else can address that. I will say if you don't feel comfortable, you're more than welcome to make the decision to not open, and we understand that, and public health supports that as well. I can't speak to the financial aspects.
So you might want to call the unemployment office, I think would be the best thing to do, which will not be an easy thing to do, but if you're persistent and call early and call late, you may have better luck in getting an answer there. In terms of, and there was also a comment that the Federation of State Massage Therapy Boards has a great 45-page resource. Donna, you were the one that posted that. If you got the link and can enter it into the chat, we'll be sure to add that information to our resource list as well. And all of the links are available on the Chamber's resource page. If you go to ashevillechamber.org/coronavirus, that's where the virtual toolkit will be, which has the county's information about the return to work through phase 2. It has a whole appendix by industry sector, which should be helpful to you. There's a list of all the PPE resources that we could find about who's selling it and contact information. And then there's also the downloadable posters and materials, tools that you can use for restarting that Buncombe County has put together. So I urge you to go there and look for it. Here's another couple of questions I want to get to, Fletch, and we'll get back to the ones that are on chat. We are a business that holds some classroom training. The space is 1,000 square feet, and there's more than adequate space for 6 feet of separation. Yet we do not understand the 10-person gathering room at that limitation of 10 people. Can they, if they've got the space, 1,000 square feet, and can separate people by 6 feet of separation, can they do?
I think you're asking about the mass gathering guidance, which is 10 people inside, 25 outside. But if you're operating as a business, it's very clear in the order that the mass gathering guidance does not apply. You go by the 50% capacity or the 12 people per 1,000 square feet. So as long as you're in the building operating the function of the business, which training would be, you go by that capacity number. That mass gathering guidance is more at this point for like social gatherings. Like if you were to go to a friend's house or out to some event somewhere, that's 10 people inside, 25 people outside.
Great. And one other comment you had indicated already and spoke to, or maybe it was Jessica, talking about cleaning products. This person suggested that we let people know that essential oil cleaning products are not EPA approved.
Yeah, so that's a good point. I know a lot of people, like including myself at home, try to use green cleaning products as much as possible. But at this time, we need to go by the EPA guidance. And there's a list, it's not just like 5 or 6, it's a whole list of approved products for cleaning. And we need to shift away from the green products for a while that don't have the same efficacy against coronavirus and use those. I saw a question about, what are the appropriate face coverings for clients? So for this, the purpose of face coverings at this point, what we're recommending and mandating is ultimately it's a physical barrier to knock down respiratory droplets, to knock down your exhalation so you're not dispersing those droplets and suspended liquid particles. So it can be anything as simple as a bandana or a folded t-shirt. It can be a medical grade PPE, like a surgical ear loop mask or N95. So all that stuff, the neck gaiters, a folded scarf, anything that's really kind of covering the nose and mouth, even if it's loosely, as long as it's knocking down those breaths, is what we're looking for here. We do, if you have N95s, you can use them, but we recommend trying to use something else because there's still scarcity and supply chain issues for that medical grade PPE. And we're trying to conserve that for first responders, medical personnel who are on a day-to-day basis interacting with sick people in close contact. So we're trying to conserve those medical grade PPE and just have people use ear loop masks, or even better than that, bandanas, face coverings. The county has purchased 10,000 bandanas. We're going to distribute. We're probably looking at ordering another 10,000, to be able to give out, as people maybe can just use those in time and reuse them. The great thing about the cloth ones is that you can wash them and reuse them for weeks and months. If you have 2, you can alternate between days, as opposed to, medical grade masks. If they get wet, you can't really sanitize them and they degrade and lose their form and function, after about a week or 2.
Okay. Do you have any resources for signage and spacing marks and labels? I think we probably have that on the PPE list, frankly.
Yeah, and I think Tim shared a link to that. If you go to buncombeready.org, there's one of the articles on there is resources and like signage for businesses, something like that. That there's signage there. It's being updated with our new guidance. There's also going to be new signage for the required face coverings. So that's going to be updated as soon as we have our order finalized and signed. That's going to be on that website as well as links to the governor's executive order 141 and his FAQ document. So buncombeready.org is your resource for all things COVID-19 from the county.
Do you have any guidance on using capes or sanitizing capes for clients during hair services?
I'm not really familiar with the difference between a traditional hair cutting cape and a sanitizing cape. I know you guys should have multiple capes so you can sanitize them. You're not using the same cape between customers. So you have one, you can put that aside, sanitize it, wash it overnight, and switch to another one. But anything you can implement, you have to implement the stuff in the guidance. There's recommendations in the guidance, but then anything else you can implement on top of that to protect yourself and your clients, I would say go for it. What we do want to do though is make sure, like with gloves, people get this false sense of security, and then we realize people are actually more negligent when they have gloves and cross-contaminated across whole communities. So we want to make sure we're doing stuff smart and not getting a false sense of security from a sanitizing cape and then reusing that, or cross-contaminating between that and your door handle and all your barber's equipment, stuff like that. So just be really smart about how we implement these protective practices.
Okay, yes.
Kate, if I could jump in for just a second. This is Tim Love, and I've been seeing a lot of questions that folks rightfully have about safety opening. And I just wanted to stress, I think Fletch has said this, the order allows you to open and sort of sets that baseline that you can go back to work. But it still remains that if you don't feel safe in this current time period due to concerns about COVID-19 or due to specific concerns about your work environment, that's kind of a personal business owner decision. And so this isn't a mandate to go back to work. This is the ability to go back to work. And so if you feel that you can't maintain social distancing or sanitation requirements, or you don't have the appropriate PPE, we're not telling you to go back to work. We're saying go back to work when appropriate and when you feel safe. So I just wanted to stress that because I've seen a lot of questions about concerns about, how do I maintain social distancing? I don't feel like I can do that. Well, if you don't feel that you can, then you shouldn't be open, because the spirit of this order really is about maintaining that social distancing so that you can go back to work. So.
Yeah, with the accommodation that, at the point of service, you can, be a barber, right on top of somebody as long as you both are wearing masks. You could be a massage therapist as long as you both are wearing masks. So I see our independent contractors considered employees for the sake of taking temperatures. So independent contractors coming in are considered employees. So you need to do a daily symptomatic survey of them. But again, let's not get focused on the temperatures. You can take their temperature, but what's most important there is the symptom questionnaire. And we have that resources on our website. I think the chamber has some, but we recommend using ours or one similar because it's very crafted specifically. So we're not violating any HIPAA concerns. It's crafted very specifically, so we're addressing the symptoms we're concerned about. And we also have a log, so you keep track of that. So it's not taking temperatures. You can't, if you have the facility to do that, you can take temperatures in conjunction with the questions, but it really needs to be focused on questioning people about those symptoms, and we have those resources. You don't have to use hazardous waste containers for masks and cleaning papers, just normal trash receptacles, normal trash bags. As far as permits from the city, we'll have to talk to the city directly about that. I don't know what their plan is, but about the permitting, but going forward, outdoors, you can now have classes of up to 25.
Fletch, I'll jump in there, and
Yeah.
Not with the city of Asheville, but we've spoken about this issue as recent as yesterday, and the city is going through a process about how to use public space. And so that application and permitting process is something you would talk directly to the city about, but they are evaluating kind of all of those asks that are coming in at this time. So.
I see a specific question about facial and facial waxing. From my read of the order, like these kind of grooming spas are allowed to operate. I didn't see anything specific in my read through talking about, face on face kind of services. So in my read, I would say they're permitted, just as the barbers and massage parlors are. But I think you need to understand that, somebody has a mask on, you probably have to work around that mask and whether that's a risk you want to take. But I don't see any restrictions on that as I read through the order in the FAQ document.
Fletch, you got a question here from, they want a confirmation. Were you saying that yes, outdoor fitness classes for up to 25 are allowed?
Right. Providing you can maintain the 6 feet of distance, you practice other health best practices, but you also have to observe any and all closures or mandates from the individual parks or spaces you're utilizing. So make sure that's clear first. And yeah, so that's the new guidance. So if you have a trail running group or a outdoor yoga class, you can operate, but that you still have to maintain. You have to have 6 feet intervals. You have to, not be shaking hands and hugging and stuff like that.
Okay.
And you have to. That doesn't mean if you had a permit to operate, in a park, you probably need to reassess and make sure that work with the city or county, make sure that permit's reinstated before you go out there.
Another clarification question.
Yeah.
If you employ independent contractors,
Yeah.
are they considered employees for the sake of ensuring that they're not ill? We've already talked about taking temperatures. Does the owner of that place where the independent contractors work, do they have to document the health of workers?
Yes. So, whatever structure is in that facility, if you have multiple contractors coming in, they need to be ensuring as if they're employees because they're coming into that space. And, we have those tools and resources.
Okay. Well,
And then those individual contractors, if they have their own employees, they need to be, doing that as well.
another clarification question about facial waxing.
Yeah.
So it's a confirmation. It's allowed as long as the client can remove their mask as long as the waxer has a mask and facial shield.
I'll take another read through on this order, but when I look at, section 5D in the governor's order, personal care, grooming, and tattoo business. And I see the workers shall wear face coverings when they are within 6 feet of another person. But in the county, we're saying if you're in your business, you're wearing a mask. I see that guidance. I see core signage, screening, and sanitation requirements we talked about. I see ensure that all equipment that comes into direct personal contact with customers and all furniture and service areas, such as chairs, capes, and shampooing areas, are completely cleaned and disinfected between each customer. I see recommendations for some other things, but I don't see any restrictions on specific grooming. I read it as the grooming is allowed. So we'll get some further clarification on that. But as I read it, that's fine. The employees obviously need to be wearing their mask that whole entire time. If someone needs to remove their mask, for momentarily to get those periods, those sections, I think we need to think about the time period. And, you're very close. We know there's a contact, so it shouldn't be for extended periods. So have the mask on most of the time. Maybe if you could do that, the best way you can manage it. But as I read it, that's not restricted.
There was another question about permanent makeup artists and tattooing faces.
Mm-hmm.
So they can't have social distancing inches from the client's face, but they could be wearing masks and shields. I guess the person who's doing the work.
Mm-hmm. And a mask, again, like masks are required. The shields, depending on your industry and sector, also would be a great best practice. But as they read it, there's no restrictions on whether, you're tattooing somebody's shoulder or tattooing somebody's face.
There is a question from a massage therapist about massage therapy clients. Are they required to wear a mask when they're face down with their face in a face cradle?
I knew we'd get this question. So as I read it, it's saying that, everybody should be wearing a mask, and we're mandating as the county that, if you're in this kind of commercial business public setting, that everyone's wearing a mask. So I think that's, I would recommend that. I understand that, sometimes it's hard enough to breathe in those things anyway, once you're face down. I have to, as I read it, yes, that's required. They're in the space, they're breathing,
Well, and also there's best practices that were referred to earlier, and I believe there's a link in the chat for massage therapists, and you might want to do a little additional investigation.
Yeah. I think probably in that 40-page resource, I bet they address that at some point.
I bet they do too.
And I would say, from, as I'm thinking through this, the industry experts would probably, I'm assuming they're thinking through the best way to address that and go from that guidance.
All right, this is a similar type of question, and I think, how is an esthetician able to give a facial with a mask, or should that service not be given at this time? I think you've said wear a mask and a face shield and limit the amount of time, correct?
Yeah.
Let's see.
Say, Martha, sorry about referring to them as massage parlors. I think that's in some guidance I saw somewhere. Thank you for that education, though.
Yeah. I understand acupuncturists are being advised not to allow clients wearing masks to be face down because of lack of air.
Again, so that's probably reasonable. I think if that's the guidance, as far as acupuncturists and what we see in the guidance from the industry experts for massage, that's fine. I think it's very clear, though, when they're not face down the table, when they turn face up, or when they're, entering and exiting the space, they need to have that face covering on.
Fletcher, are there any recommendations about safe air quality, whether or not you should keep air flowing or have HEPA filters or anything like that?
Yeah, so maybe Jessica could jump in here, but I haven't seen anything that says, HEPA filter specifically is known to be effective to any specific degree against COVID. I think in general, it's good to have that. I think if you get open air, possibly that'll help. I think open air, like a window, always helps those situations. There are concerns about, if you have ventilation systems and you're recycling air, that can be of concern. Jessica, do you have any insight there?
I do not. I can do some research and get back to this group, but I haven't read anything specifically.
Yeah. Again, I haven't seen any specific like CDC, FDA, EPA things on air filtration, so I can't really speak to that.
Fletch, I did go back up into the chat, and Donna Gray posted, I think it went to all panelists. We'll need to get it reposted to the entire group. It's the FSMTB, Federation of State Massage Therapy Boards guidelines for practice with COVID-19. So that could be really helpful to those of you with questions. I'm going to copy that and post it to everybody. Thank you, Donna, for giving us that. Are there new regulations for public bathrooms? In the last few years, there have been a trend toward those cold air dryers, but I'm reading that they are full of germs. Information on that?
I think even apart from COVID-19, hair dryers, there's always concerns because you're blowing air, blowing particles. I've personally been staying away from them and trying to use paper towels. That's just general guidance. I see questions about, eyeliner and tattoo is 90-minute service. I mean, that would give me, knowing what close criteria contact is, that would give me a lot of concern, as would any tattoo or any barber's visit. So I think everybody needs to weigh that. But as we look at the guidance, I don't see that's not allowed. But it's even with a face covering on for 90 minutes, a foot and a half, a foot from somebody's face, that's very concerning when you don't really know if somebody not has COVID-19. So I don't see restrictions against it, but that determination, whether you think that's a good idea, would be up to you.
Hey, Fletch, it's Tim. Can you talk a little bit about the process for face covering guidance? I know that's something that kind of came about yesterday. So I expect there will be additional discussion and maybe some exceptions that are made. For instance, I'm thinking about someone in a restaurant. You can't really eat with a face covering. There will be some practical exceptions that will be fleshed out. Is that fair? Can you talk about that?
Yeah, we know you can't eat with a mask on, not very well anyway. We're working on the language. These were concerns of public health going forward. The commissioners voted to enact this mandate yesterday, so we're still working on language, how to address that. But we anticipate that most of the municipalities will not follow us on that guidance. So that's why I've been using the terms unincorporated Buncombe County and Asheville. But we don't have that language yet. Our attorneys are putting it together as we speak.
Fletch, we've got another question here. Remember to put your questions, please, into the chat rather than into the Q&A. As the guidelines on the amount of people allowed in one space refer to the overall square footage, what is the guidance on smaller rooms within that square footage? For instance, small break rooms in larger businesses.
Yeah, so that's where we get into, it's a holistic look. It's not just the square footage and 12 people. It's not just the capacity. It's also the 6 feet. So, if you have a break room and you can fit 4 people in there to sit down and have coffee at 6 foot intervals, that's fine. If you can't, you can't be lording in there. You go in, take turns, getting your coffee, taking your break. But you have to engage all those constraints. As overall building, 50% capacity, use the guidance for 12 persons per 1,000 square feet, and 6 feet distancing to the best extent possible when you're not delivering the close contact service itself. In service delivery, clearly you can't maintain 6 feet, but that's the difference as you transition from your business space to the close contact criteria. There's an allowance for that, but in general, for like a break room or a lobby area, we still have to maintain that 6 feet.
Do y'all have an opinion about the air filters with the UVC light?
I think it'd probably be helpful, but I can't speak to the efficacy because I haven't seen personally studies or direction from CDC, EPA. It might be there. I haven't seen it. I could look. I would say, as you guys look at things like that, like HEPA filters, air filters, whatever, I know the company itself will say what it's effective against. I know, you'll see reviews saying stuff. What we do at Public Health is we look for, confirmation from CDC, FDA, EPA on those things. So not just taking the contractor, the company at their word, but making sure there's scientific confirmation of those claims.
Fletch, there's a comment from Jenny here. Most spa services take at least an hour. Was that taken into consideration when the decision was made to let spas reopen?
Yeah, it would have had to have been. I think at the state level, I think they understand that massages can typically go from 30 minutes to an hour and a half. And I think they understand that at tattoo, you don't get a tattoo done in, typically 15, 20 minutes. So I think that was taken into consideration. it was weighed against, we're in a constant tug of war right now, a really tough tug of war between protecting people's safety and their lives and protecting people's industry, their business, and their livelihoods. I think that the determination was made because of our numbers, our metrics, because this is all data driven across the state, where our trends are, mostly plateauing and being flat, looking at all aspects of it, looking at it within context, that we can allow this because we think we have the measures, the steps, and the resources in place now to mitigate, make sure we don't overwhelm our healthcare systems, reduce transmission as much as possible while allowing us to get back to business. And that's really what, the stay-at-home orders and all the lockdowns we did got us, is it first of all, it didn't overwhelm our healthcare systems. We did a really good job of that because that was a concern, the number one concern. Number two is it bought us time so we could develop these plans for this brand new threat we've never seen before. We can have plans now for how we can isolate and quarantine better. We have resources for public health to make sure we can do this extensive testing and contact tracing. So we're in a much better footing now compared to even 2 weeks ago, let alone a month, 2 months ago, to respond. Because we know as we open up, undoubtedly, we're going to see more cases and unfortunately more deaths. But we think we have the measures in place to respond in the best way possible as we see those. But I do want to remind everyone, this phased reopening is not one direction. If we start seeing the trends going the wrong way, at the end of June, sometime in July, we may have to step back and be more restrictive on things. This is the dance we talk about, moving back and forth as we see our metrics trend different directions. But if we do this smart and deliberate, there's a better chance we can just slowly continue to reopen our society and our economy.
All right, we've got about 5 minutes left. If you have any additional questions, please enter them in the chat. I want to mention that we're going to be having a session related to restaurants at 10 o'clock today, which will provide some good information for restaurant reopening. And then there are 2 sessions this afternoon through exploreasheville.com, and they are related to lodging as well as to entertainment and event venues. So that'll be good information for anybody who is related to those areas. You do have to register in advance. You can go to our website at ashevillechamber.org/coronavirus and find a recording of this particular program as well as the others after they are over today. And we're also going to have this virtual toolkit, which will be ready by the end of the day, which includes all of the county's materials. And we're working with all our strategic partners at Explore Asheville, Mountain BizWorks, other organizations throughout the community. We'll all have the virtual toolkit, which will include things that you need to provide the proper resources for your business, but also to deal with your employees and the signage that you need. So we urge you to look at those things. Are there any last questions here or any comments that you care to make? Feel free to post them in the chat. And don't forget about the business@buncombecounty.org opportunity to my colleague Erin Leonard says we can send email all the attendees the links as well. So we're happy to do that. But if you have specific questions that you didn't want to share today, you can send them to business@buncombecounty.org, which will be a great resource for you in terms of getting specific questions answered. I also urge you to think about going back and looking at professional material if you belong to a professional association, and you can also check out the details of the order. Those things are available online at these resources. So go and do a little bit of due diligence to make sure that you're prepared. And bottom line, this is your decision. It's your business. You can do what you can open or not reopen, but there are guidelines that exist to help you make that decision and to keep yourself safe. Fletch, any last comments you want to make?
Yeah, just a couple. One, as we go through different phases, we see a huge influx in emails and calls to the Ready team and business email accounts. So just be patient with us. We might not be able to respond, within a couple hours. It may take us, a whole day or, overnight. Some of this stuff is very complex and not addressed through the governor's guidance our own. So we have to sit down and discuss it. So, sometimes, that takes some time. Also, our intent today is to have our local order signed at 3 p.m. for today's media update. If you want to watch live, it's on Facebook Live for the county page, Buncombe County Government. But as soon as that's signed and in effect, we'll push it out to the community, post it on our website, that local order. For the most part, it's going to be aligning to the state guidance, once again, an FAQ document with a couple exceptions where we're more restrictive, but not, I don't anticipate any restrictions on this business sector.
And that goes into effect tonight, Fletch?
At 5 p.m.
At 5 p.m. Jessica, any last comments from you? Or Tim, any comments from you that you'd like to share? No.
This is Tim. I just really appreciate everyone dialing in and sort of working with us through this process. We know it's been highly stressful. And, Fletch and Jessica, the whole team, we're all here for you. So if you have any questions, please don't hesitate.
Great. Well, we thank you. Thank you, panelists, for joining us. Thank you for attending. We hope this has been helpful to you. Please seek out those resources and keep yourself and your customers safe. Thanks very much.